Hello and welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Now, over the last 2 years, both our mental and physical health have taken a hit as our world was disrupted by COVID and lockdown. Anxiety, isolation, boredom, depression, stress became more common among people and had a significant negative effect on the well-being of people. People used lockdown as an excuse to avoid physical activity. Working from home is no excuse to stop exercising, and physical activity or exercise can improve your health and reduce the risk of developing several diseases like type 2 diabetes, cancer and cardiovascular disease. Exercise helps people lose weight and lower the risk of many diseases related to obesity. Regular physical activity can bolster your defense against any infection, and for people who have diabetes, the benefits of exercise can't be overstated. People with diabetes and heart disease are generally confused about the right type of exercise for them, and today we have a panel of experts to address any questions and doubts that you have on that front. We're joined by Dr. Manohar KN, consultant physician and diabetologist, Manipal Hospitals, Bangalore, and also a marathoner and fitness icon for Kidney Warrior Foundation. Thank you, doctor, for being with us. Also, Dr. Amit Kumar Singhal, senior consultant interventional cardiologist, Fortis Hospital, Jaipur. Thank you, doctors, for taking time out to answer all our questions. And Dr. Manohar, first to you, how much exercise is recommended for people with type 1 and type 2 diabetes, and what type of exercises are recommended?
Okay. So at the outset, thanks a lot for keeping me in the panel. And you rightly said, we all know the COVID pandemic, but there was a silent pandemic which was happening, that was the obesity pandemic, which this COVID would have fueled it, worsened it, and we are looking at a twindemic later. Too much exercise also doesn't show any great benefit. So what is the optimal one? Before that, firstly, we should understand that it is not that we have some disease and we start exercising. Exercise is for everyone. Coming to the diabetics, if you look at the children and adolescents, the recommendations are 60 minutes of exercise per day, moderate to vigorous intensity, include your strength training at least thrice a week. If you're talking about adults, we should engage in 150 minutes or more of moderate to vigorous intensity aerobic activity, at least spread over 3 days, no more than 2 consecutive days of bunking exercise. In recent times, we have emphasized on resistance training and weight training. So 2 to 3 sessions per week is important. We all know now that sitting is the new smoking. So interrupted sitting, prolonged sitting, if you are doing, please interrupt it at least every 30 minutes. Last but not the least, flexibility has come into the vogue, and flexibility should be inculcated at least twice or thrice a week. Yoga is the greatest way of doing it. It will bend the body and mend our mind.
All right. Now, Dr. Amit Singhal, it said that even people with no history of any heart disease are at risk of heart disease, especially after the COVID infection. This is something I think doctors are still finding out more and more, the impact on the body. So what preventive measures can they take before starting their exercise routine? Do they need to undergo any sort of test before starting on an exercise regime?
Yeah. Hello, everyone. Thank you, ma'am. COVID itself puts ourselves at risk for heart diseases. COVID can directly affect our heart, leading to myocardial dysfunction, rhythm abnormalities. Even it can make our blood thicker, leading to clot formation and heart attack. Right. So COVID patients are at high risk of heart diseases. Okay. Best thing is we should have a prevention from COVID with all the precautions and COVID vaccination. If at all we develop a COVID disease, then before going for exercise, we should have a routine evaluation, cardiac status by a physician or a cardiologist, and if our heart is working optimally, then we can start a exercise protocol. Otherwise, without going for an evaluation and going for exertion, not knowing the status of the heart could be dangerous. So prevention is better. COVID can definitely affect our heart, but not in all cases. So don't panic. Not all patients with COVID develop heart diseases. Only a small subset develops, and therefore it is better to have a pre-exercise evaluation before going for exercise. Always prevention is better than cure. So always get a vaccination or prevent yourself from COVID with basic precautions. And if at all you develops a COVID, get a pre-exercise evaluation before going for exercise.
And what is the reason that just, in recent years, we've seen a lot of what we consider younger people having cardiac issues and cardiac arrest and related to exercise? If you could, tell us a bit about that.
See, I tell you, the reason for increasing incidence of cardiac diseases in young people is because of our lifestyle changes. A sedentary lifestyle, more of junk food, and then all the addictions, smoking, tobacco. These put ourselves under stress. Younger generation is at higher stress. Even younger patients who are getting hypertension. So, stress, diet, addictions, and lifestyle. This is the reason. And once in a while, we listen a younger patient developing a cardiac event. That doesn't mean all young patients, young people are at high risk, but definitely our younger generation, because of changes in our diet and lifestyle and stress and addictions, are at higher risk compared to a generation earlier. So precautions and prevention is better. And if you are developing any symptoms or you are having a family history, get a proper evaluation by a cardiologist or a physician. That is always better.
All right. Now, Dr. Manohar, in accordance with, growing appreciation that exercise is medicine, it is intuitive to suggest that exercise can play an important role in the prevention and, management of diabetes. So how does exercise reduce insulin resistance?
Well, food is the most abused anxiety drug, and exercise is the most underutilized antidepressant. This is what I keep saying. At rest, the only route for getting glucose out of bloodstream into the cells so that it gets utilized is by insulin. And we all very well know that in type 2 diabetes, especially, insulin resistance is a major obstacle for this. So exercise places an energy demand on skeletal muscles and helps to utilize this glucose and also the fatty acids via what we call it as a GLUT4 receptors. So exercise activates this alternative molecular signals and it helps in better utilization of glucose, and it makes insulin resistance less relevant, as it wouldn't affect as much as if you're not exercising and putting on weight.
All right. Dr. Arun, Dr. Amit, I beg your pardon. During this pandemic, people have got more occupied and busy with work. They hardly get time for exercise. So, according to you, what are some of the easy exercises that they could begin with to ease themselves into, an exercise regime?
Yeah, so very rightly said, because of this pandemic, we are locked at home, even we and our children. Definitely, we have gone down in our exercise levels, but it is very important to have some sort of exertion on daily basis, right? So we can do small things. Going to market to purchase something, we can go walking, that we can do. While talking on mobile, we can start walking, that we can do. In our workplace and at home, we can prefer using stairs in place of lift. These are certain things. Okay. So this is the way we can at least do some exertion, or even at home we can start some outdoor games in our neighborhood or at our home on our terrace also. So some sort of outdoor games, badminton or something like cricket, playing outdoor games, going walking for a nearby shopping, or walking and doing mobile talk. These are certain things which we can inculcate in our day-to-day lifestyle, and we can at least do some movement.
All right, that's helpful, to keep in mind and take the stairs rather than the lift. Dr. Manohar, when it comes to diabetes and exercise, timing is everything: food, medication, activity, length, time of day as well. So what precautions should a person with diabetes take before exercise? Is it necessary to check the blood glucose levels, before beginning with an exercise schedule?
Yeah, very relevant question, Gargi. The same amount of food consumed or the exercise done can have different implications and can cause glycemic excursions. It is not necessary that higher intensity exercise is more effective than the lower one. Consistency is the key. Nowadays, we have found out that resistance training or muscle building, what we say, is very relevant. And a lot of data have come nowadays that afternoon exercise, especially if your carbohydrate-rich meal is taken there, is more relevant. But again, I think we should suit our convenience, and practicality is the key there. When you look at the blood glucose monitoring, recognition is half solution. So it is prudent to check where your glucose level is first. Frequent monitoring of blood glucose, at least every 30 minutes throughout the exercise, is recommended, especially if you are looking at a high intensity exercise. And always try and do one blood glucose an hour or so before starting the exercise. Individualizing is the key here. Each individual is different. The intensity of exercise he is doing, the type of medication he is taking is different. So if you check, and if it is less than 100, we usually supplement 10 to 15 grams of carbohydrates, recheck, and if it is gone into the range of 100 to 150, we allow exercise. If the sugars when checked, if it is more than 250, we need to make sure there are no ketone bodies there. If ketone bodies are present, better not to exercise. If sugars are, when we check it with the glucometer, if it is more than 350 or so, it is prudent not to exercise. And it's not always about sugar. First is prevention of hypoglycemia. Always carry simple sugar packets or chocolates with you. Hydration is equally important. Electrolyte imbalance, fluid treatment is very, very important, especially in places with higher humidity and if you're doing outdoor exercises. If your exercise is very intense or lasts more than an hour, we recommend 100 to 200 ml of fluid every 20 minutes. If you are starting in high intensity exercise, we definitely recommend to ingest slowly absorbing carbohydrates, replenish the liver and the glycogen reserves. You might have to decrease the insulin dose, and every individual is different. And if you've done a high intensity exercise, like you've done a full marathon or so, kindly get a glucose check before retiring, because it may increase the risk of hypoglycemia.
All right, Dr. Amit, now what exercises should be followed by people who've undergone, interventions such as angioplasty or bypass surgery? Also, is it needed to monitor blood pressure or blood sugar before proceeding for exercises for such patients?
Okay. So I would like to say that all patients after having a cardiac intervention in general are advised to do some exercise. Okay. So the level of exertion basically depends upon the status of cardiac function, right? If your heart is doing perfectly well, then after initial stabilization, we can start a graded exercise protocol, which can be gradually escalated depending upon patient's tolerance and symptoms, right? If a patient is having a compromised heart, then lesser levels of exertion are advised. And if the heart is doing really worse, then at times we have to abstain from exercise also, right? In general, if you are doing well, if you are stable and you are able to tolerate exercise without any symptoms, then no monitoring is required. Only when you are going to a doctor for clinical evaluation on a regular basis, at that point of time, you can share your symptoms and discuss about how to escalate or de-escalate. So in general, if you are doing well and asymptomatic, no need to monitor. If you are having any symptoms, then you should definitely check your BP and sugar before starting exercise. So some sort of exercise is always advised to most of the patients, bearing a few, and that exercise should be gradual, graded, and especially in cardiac patients under supervision of your physician or cardiologist.
All right, well, with that, we'll slip into a short break. You're watching Health and Wellness, Myths versus Facts. We're talking about exercise and managing diabetes and heart health. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about exercise and managing our health. Dr. Manohar, what exercises should children with type 1 diabetes follow? Can they continue to participate in sport, and what precautions should they take?
I think very pertinent question, especially considering the anxiety of the parents and the teachers. Exercise in kids, yes, why not? Sports is the best form of exercise, which improves both physical and also the mental well-being. Firstly, the best exercise to do is to get them off the gadgets, is what I always feel. Precautions, as I said elaboratedly, that the precautions are pretty much the same I alluded to, and an extra precaution is always welcome. Especially the parents and the teachers need to be guided to recognize complications like hypoglycemia and dehydration. If you want to draw some inspirations, yes, Billie Jean, the tennis star, Wasim Akram, the Pakistan cricketer, and Jerry Winkler, I don't know how many of you know, is the first man to conquer Everest who was type 1 diabetic. So it is not that type 1 diabetics are not done anything there. So if trained properly, precautions taken, they have done very well. And as I said, higher precautions are always welcome in this group.
All right, Dr. Amit Singhal, exercise is considered as good as medicine, but can high-intensity exercises lead to sudden cardiac arrest or heart attacks?
See, we have to understand that heart is a pump it pumps blood, and whenever we exert, whenever we do exercise, heart has to perform more. Okay, so if we want to do any sort of exercise, we should have a healthy heart, right? If you are doing a mild or moderate intensity exercise, then it hardly matters if we are asymptomatic or relatively young people. But if you are doing a strenuous exercise that puts extra load on our heart, then it is always better to have a pre-exercise evaluation by a doctor who can clinically see, and if required can get some investigations done like ECG, X-ray and 2D echo, and ensure that your heart is doing well. So it is always better before going for a strenuous exercise protocol to have a medical evaluation by a doctor and rule out anything, any underlying disease which is invisible or subclinical, right? So mild to moderate exercise in otherwise healthy people, no problem. In cardiac patients under medical supervision, and strenuous exercise in any person only after a medical evaluation, that is safer.
All right. Now, Dr. Manohar, what exercises should be avoided with, by people with diabetes and other metabolic disorders?
Yeah, it's very important for us to know what should not be done and what are the precautions. Primum non nocere, or don't do any harm, is the dictum in medicine. So first thing is, don't compare or compete. Secondly, graded exercise. You are what you are and you try to build on that rather than comparing it with others. Most importantly, you see whether you have just diabetes or it is complicated. For example, if you have an eye issue called retinopathy, we don't recommend exercise, especially higher intensity one, for the first 3 to 6 months after the laser. If there are neuropathy, possibly swimming would be better, and concentrate on examining your foot. Heart disease, Dr. Amit clearly mentioned. If there are neuropathy which are autonomic neuropathy, extremes of weather may be avoided, yoga could be encouraged. I strongly believe that exercise should not be just written like it's an exercise, it should be a prescription. That's what I follow in practice. First is the pre-exercise clearance. Look at your metabolic status, cardiac status. Dr. Amit clearly explained that. Then I believe in grading the person. Is his diabetes complicated or it is just diabetes with mild hypertension? Second is, what is his control, not only of diabetes, hypertension, heart disease, kidney function? Third is simple foot examination, appropriate footwear, maybe one size larger shoes are always better. And fit principle is what we all follow when we prescribe exercise. What is the frequency? What is the intensity? What is the time? And what is the type of exercise? Then look at the patient. Everyone is not the same. So I always grade the patient as individualizing him, whether the person is not active and no intention, you have to train both, or he is having intention but he is not enough active. Or he is active, doing well, but we need to have a maintenance. So there I create a peer group for them. And we prescribe how much, as I said, weight training has come into vogue at least twice a week, yoga flexibility twice a week, aerobic 2 to 3 times a week. And reinforce them, show them, see, you started the exercise this month and see the better results on your weight, self-esteem, which is not often measured, how you look, how are the metabolic parameters of sugar, pressure, everything. Most importantly, emphasize nutrition and sleep. Exercise is not just working out. How you feel at the end of the day is very important. One of the questions what you ask is, can exercise kill? Only because if I wake up and if I'm not feeling rested, I always tell my trainer I'm not going to exercise. So don't overdo it. Overkill is not going to help anyone.
All right, important to keep that in mind. Don't overdo it either, but yes, inculcate, exercise in your daily regime. Thank you so much, doctors, for joining us on the program and answering all those questions for us. Thank you all for watching at home. Goodbye.